more of a commitment on the longer term. So interesting, watch this space. I think that will be a very interesting one to watch. So now we're going to dive over to my favorite bit, which is getting you all introduced to our wonderful panel. At this point, I just want to remind everyone, please do ask questions and put them in the chat facility. We will allow for time at the end, so we can really make sure that everyone's questions get answered. And I'm sure our panelists will be sticking around to answer those. So without further ado, I'm going to get you all introduced. So I think we've got everyone with us. At the moment can't see anyone, so yay, I can see Martin, that's fantastic. Oh, and I can see Nick, brilliant. And hopefully Jill as well, yes, brilliant. It's good when a plan comes together. So thanks so much for all joining us. What would be a really great place to start is to just, if you can introduce yourselves and tell us a little bit about the organisation that you come from, your kind of area of expertise. I'm just going to go around my screen, and Martin, you are first up. So if you can, please do a little introduction. That would be fantastic.
Great, good to be here. Thank you very much. Nice to see everybody on what is a sunny afternoon, for me at least. Yeah, my name's Martin Yelling. I am the CEO of a children's mental health charity called Stormbreak, and we work with children and young people in education and health settings, and just in some more social settings as well now, helping those trusted adults and children understand how to use movement to support their mental health through something that we call a storm break. So we try and equip those children with skills and strategies to help them in the now, but also to help them transition as they grow, when perhaps they wrestle through a few things.
Amazing, thank you so much. And Jill, would you please introduce yourself?
Sure. Hi, Gabby. Yes, thanks, everybody. My name is Jill Houston. I run an organisation called the Hummingbird Project. We are set up based in Northern Ireland here, and we are really looking at mental health across the mental health journey over the lifespan. So not just dealing with people in terms of mental ill health in the moments and times when that happens, but actually looking at people's overall monitoring, as you were saying, of their mental health, building resilient skills, building up the knowledge within communities to know how to do this stuff for ourselves, and really at the heart of what we do is tapping into an individual's own expertise that they have on themselves and helping them to unlock what works for them best of all. So it's very bespoke, very person-centered. We are a social enterprise, so we also go into the corporate world, because other than the crisis of the bottleneck of people presenting to the GP when they become unwell, most of the rest of the time, most people are at work or at school or university. And so we need to engage people in those conversations earlier, to look at their resilience earlier and to give them the skills to be able to manage earlier. One other thing about the Hummingbird Project is we are a lived experience organisation. We have over 150 years between the staff here and the directors of managing mental health between us. We still do it now on a daily basis. And that adds something to our professional trained and learned practice, which our clients tells us makes a massive difference to them. So that's all about us.
Amazing. Oh, so interested already. Can't wait to chat more. And Nick, definitely not last but not least. It is just my screen, I promise, Nick. Could you give everyone a little introduction, please?
That's fine. Thanks, Gabby. So my name's Nick Pollard. My wife and I co-founded Family Mental Wealth a few years ago with our daughter, who is a GP, but when she was a teenager, she was very ill with anorexia. And she will always say that she's very thankful for the professionals that helped her, but what made the real difference was the family-based self-help. Drawing really upon what's now become known as the New Maudsley method for skills-based caring. And so Family Mental Wealth is developing digital tools to facilitate families being able to build their mental health and well-being through these tools of developing knowledge and skills, particularly to address the underlying risk factors, which we're all subject to different risk factors, but to address those risk factors which can drive mental ill health, but to be able to develop the skills to develop protective factors to mitigate against those risk factors so that we can all build mentally healthy lives.
Amazing. Well, there's so much experience on our panel. It's fantastic. Thank you all for joining us. So kind of the first question that I want to dive into a bit, having heard your introductions, and obviously I know a little bit about you all already, is it would be good to explore what are the opportunities technology has kind of posed for your individual organizations. You're all kind of coming at the different angles, different audiences in different ways. It would be interesting to see the synergies or the differences between you all. Martin, knowing what you do in terms of young children and storm breaks and kind of accessing with school-free movement, what are the kind of opportunities with technology that you've seen?
I think there's quite a few, actually, Gabby. I think I'll kick off with some of the challenges, and then I'll come back to the opportunities.
Please do.
They've certainly created the potential opportunity for us, but it's been challenging, actually. So Stormbreak as an organisation, pre-pandemic, did a lot of face-to-face delivery. Of course, what that meant when we were suddenly unable to see people face-to-face, was that effectively our charitable work would have ceased. It would have ceased had we not been able to create new ways to reach target audiences in schools and in families. And of course, the way to do that was to try and reach them at home. And to try and reach them when they weren't in schools, and to try and reach them largely through what we did was create a digital portfolio of some of the work that we might do with those young people. Now, we're obviously not able to create that digital support platform in the same way as if we were to work face-to-face with people. But nonetheless, what that enabled us to do was to still maintain some support and encouragement. So the opportunity came in the last 18 months, mainly through a redesign and a re-engage and almost a refocus on how to reach existing and new audiences through digital content in a meaningful and impactful way. And so we actually built a new platform to enable children, families and schools to do that, actually, and to do that whether they were at home, whether they were returning to school, or whether they were, as they are for some of them still doing, somewhere in the middle, at school sometimes. And so, yes, the opportunity it gave us was to create a platform to still reach people that we want to be able to support digitally. Now, in the longer term, that's actually created a whole series of other new opportunities about the way in which we can blend our approach face-to-face and digital, the way we can scale our approach, the way we can target new audiences, the way we can co-create content, the way we can use different narrative and different voices in our content going forwards. Now we've got a digital infrastructure to enable that to happen. So it was a bit of a required agility from our team, and we've just started to understand how digital can really have some meaningful power to what we do.
I think quite an interesting one in the and I'm sort of interested to understand, because I know a chunk about what you guys do. We had a client working in the child mental health space, and what they had was a series of activity cards, physical cards that you could parents could buy, and then it was something they could do with the child to help tease out various issues, or try to keep their minds active, that kind of sort of activity. And they came to us, and we were looking at sort of digitizing these cards, and we were like, this is fantastic. This is perfect for digital. We can gamify it, and we can have levels and all this different stuff, and it all looked brilliant. And the user feedback, the kids were like, this is really exciting, this is great. And when it went through, they had their like sort of panel of the mental health experts. they were like, Christ, no, what are you doing? This is exactly the wrong behavior. This is not the right, we don't want the kids to be, the point of these things is not for them to sit on a phone and get all excited about, gamifying behavior on a phone. And it was like, oh God, yeah, no, you're right. And we had to really tone that back. So getting the balance with technology between all the good, interesting pieces that make these things addictive, but without the downside of, but we don't want them to be like that.
So there's some really, really important points there. Our goal as a charitable organisation is to support the well-being of our beneficiaries, and often that's not necessarily a shared goal with some major tech companies. And clearly, it's absolutely vital that the way in which any product, program or platform is developed and informed contains the appropriate, relevant guidance necessary for describing how the support can reach the individual. The language is so vital and so important. What might seem like a throwaway comment in the context of a digital discussion around a new product or program, actually, to particularly to a young person, can have a striking impact on their mental health. Yeah. So we carefully consider our language, and that should be carefully considered too for those people looking to build out new digital products for potential audiences. And definitely not at the forefront of our driving passion is a desire to cut corners on high level content. And certainly with our preventative approach, it's so important to have it informed, clinical, evidence-based, and actually something of use to support the young people that we might help, rather than sell a subscription for something which is arguably not what we're about.
No, it's so interesting, and I think in terms of, we have done these Tech for Good talks for a little while now. They were also born out of COVID, when we couldn't get out and about and talk to people. But, I think that a lot of that conversation we have with panelists tends to come back to actually, yes, like these were all the challenges, and we had to kind of respond really quickly and adapt. And actually, there was a lot of downside in that, because face-to-face is so important, but actually we got to reach more people and we learned really cool lessons, and we now are thinking differently about the approaches. So I think that's really interesting in terms of that experience that you had yourself. And Jill, thinking about what you guys do at the Hummingbird Project, was that a similar kind of challenge and a similar opportunity, or have you got kind of different ones that you found?
Yes, I think, early in the pandemic, we had to make the decision: do we continue to support our people, or do we shut down with the rest of the country? And we are involved in a suicide prevention program, which is extremely important. And it was a no-brainer for us. It was a case of saying, we have to find a way of making this work. And I'm struck by what Martin has said there about this idea of supporting people face-to-face is infinitely better than doing it in any other method. But unfortunately, COVID came along, and that just isn't possible. So it's about making the technology work for you, but not just for you, but for your participants as well. That's really important. I think one of our biggest challenges, because we pivoted some of our corporate work very quickly onto Zoom, and workers remotely working from home, we're very used to that format. We've a high level of facilitation skills within the company, so we were able to create an atmosphere. It wasn't perfect, but it was certainly replicable for our participants. But what we then found was the most vulnerable people that we supported really were suffering from tech poverty. They didn't have the means or the access to sit for an hour on a data signal on a mobile phone to do something that wasn't as effective as meeting face to face. So we became interested in this idea that there's an organizational upskilling that has to happen within our organization, but there's also the assistive skill upskilling that we can provide participants to give them the knowledge of how to actually come on and work collaboratively online with us as well. I think, one of the big challenges here was we needed to look at organizationally, what tech were we using? We're a bunch of mental health specialists, and most of us really don't care very much. We're sitting in front of screens a lot of the time. We're people, if you know what I mean. And so it was very vital that we started to make our staff comfortable with the idea that for now, there needed to be this impact online. And then there's the external impact. Is what you're producing, very often very quickly, because lockdowns came and went at various times, was it good enough? Was it just something that we were doing because it was better than nothing, or was it actually having an impact? And that's still a question through which we innovate all the time now. The opportunities for this, for us, was very much being forced into that position of thinking outside the box, of thinking, how can we create the same secret sauce that we have when we have a participant group or a client coming in one-to-one? How can we recreate that in a way that's both comfortable in a therapeutic situation for the mentor and also the client as well? And we're still thinking about that, but it's an interesting process to go through, because it's making you think more deeply about the practice that you had and identify the elements that are very specifically important to you. And all of this takes the big elephant in the room, which is money. So that's been another interesting journey. Charities, by definition, want to try and use the vast bulk of their income directly to have impact for their beneficiaries. And as a social enterprise, it was very important that any money that we received, that we made that money grow in order to benefit the people that we serve. And so all of a sudden having to hire somebody as a tech person within the company, we needed to really sit and consider, is that the best use of our money? So there's lots of interesting questions in there. And for me, it comes down to tech is only as good as the people that are operating it. And that really becomes your bottom line.
I think that's really interesting, that impact, like actually measuring what you're putting out there, and is it having an impact for the users, that, you're all here to kind of make better lives, and kind of that is just so crucial. And in terms of everything we do, it's certainly something we always, come back to, and we're like, what's the difference? What's the impact? That's really, really interesting. And I think, again, like those challenges around that financing, like it's a really interesting one across kind of different sectors at the moment, in terms of where we know there's these gaps in the market. And, COVID has really shone a light on some of the areas that are underfunded and there's less resources. It's really interesting to hear those kind of barriers. Nick, again, I'm so lucky. I know you well. I've been on a kind of bit of a journey with you yourself in terms of what you're doing. I know you're doing some really, really exciting things at the moment. It would be great to hear a bit about those opportunities that tech has posed within the organisation for you, and the challenges, if they're similar. That would be amazing.
Yeah. Well, my original professional background was in academic research and psychology. So I always come at things of thinking, okay, how can we research? What will be the best? What are the needs? How can we make sure that it's truly effective? And of course, our daughter, being a doctor, she wants to know that things are really effective. There's no point doing it otherwise. And in the academic literature, there's two big gaps that are talked about in mental health provision that we kind of largely set out to see what can we do to make an impact in those two gaps. And technology can do a lot to close those two gaps. Those are sometimes called the clinician-patient gap and the research practice gap. So the clinician-patient gap is that there's not enough trained clinicians and for the need that there is, and there never will be as the need grows. The government talks about investing more money in more clinician training, but or currently now we've got 10% of psychiatry posts are vacant. So what can be done to close that clinician-patient gap? Well, tech can do a lot to do that by bringing evidence-based knowledge and skills directly to the people who need them. So our particular what we bring to the party is this whole how we can take the new Maudsley method for skills-based caring developed by our collaborators there at King's and Maudsley, and how we can make that available to everybody through a digital distribution, which is what we're doing through our product Headway. And then the second gap after the clinician-patient gap is sometimes called the research practice gap. That is that it takes years for new evidence-based knowledge and skills to filter down to clinicians. That's just the nature of the kind of training process and implementation process. But tech can close that gap by bringing new evidence-based knowledge and skills immediately to those who are using the resource as soon as it's implemented in the technology. So one can create something that scales up, reaching lots and lots of people with this evidence-based knowledge and skills, and make it so that actually you also close that research practice gap so it can stay cutting edge and not become dated when there is new evidence-based knowledge and skills, which is developed by our centers of excellence who are developing those. So that's where we're at, really.
Yeah, I think that's, again, really interesting, and it kind of resonates in all the different things that we've been talking about so far in terms of all the different areas, that these gaps and how technology, and really the importance is where the impact is for the user and where the gaps are for them in terms of filling those, rather than seeing technology as kind of like a magic, I can't think of the word, solution. Yeah, that's going to solve everything. It's really interesting, and I think it's certainly really reassuring for us to hear that, because it's very much what we usually telling people when they're coming to us talking about projects, but it's very much at the heart of that. I guess something which kind of leads on and might be a quick question to whiz round is really, we've talked a lot about technology and the opportunities, but like, has the technology become a bigger focus since COVID? I mean, it sounds like for lots of you, there's noddings of heads. It's been mentioned, but I guess it's interesting to know if it was a path that you were on before, if it was a focus you knew you needed to take and kind of COVID gave you that kind of tiny shove, or if it was like, no, this is actually the focus is now because of COVID. Martin, do you have thoughts on that?
It was certainly a focus for us from the outset, actually.
Yeah.
We are very privileged to have on our board of trustees the founder of Parkrun. And for those of you who don't know, Parkrun is now a global movement of physical activity, running around 5K or walking and volunteering around a local park, and the many benefits to physical health and emotional well-being that volunteering in your community and being active can have. And Paul, when he founded it, although it was effectively about walking or running in the park, he knew that it was also about how to digitally engage with people that were taking part to keep them enthusiastic and motivated and give them some insight. And so he geniusly came up with this little barcode which enables you to participate anywhere around the world in any park run, and also gives you lots of stats around engagement. And so very early on at Stormbreak, we tried to build a similar thing around when anybody at a school or anybody at home participates in a Stormbreak, they can track that engagement. And so that gives us a little bit of an evidence base to work from with people. It also gives the ability to give some insight and feedback back, but it really is only a start point.
Yeah.
And so I wrestle with this quite a lot. What I wrestle with is the tension between supporting children's mental health and trying to do that in a digital way, in a movement way, without any of those things being potentially harmful or children suffering any negative impact from that engagement. So although there's an awful lot of opportunity, there's also quite a lot of potential risk that we've got to mitigate when we use, in order to use technology effectively. Ultimately, I hope that what we do, we can utilize technology to give children and adults some strategies and skills, but ultimately they'll go away and learn those skills around relationships and hope and optimism and self-worth in their day-to-day environments, making and building relational connection with the people that they spend time with. So the platform is just one way in which we can potentially make small impact. And just before you move on, Gabby, it's really important to note, I'm sure other panelists and people listening would agree, there isn't a solution. And we really shouldn't think of things as solution. And for a long time, at Stormbreak, we got quite frustrated with trying to improve people. And actually, for us and Stormbreak, those are the wrong choice of words. People often live with their thoughts, feelings, and emotions every day. And what we have to do is support and encourage them how to do that, rather than try and solutionize or fix them. And that's a really important point. Certainly one that we don't underestimate or overlook.
No, I think that's really powerful. And thank you for sharing that. Jill, in terms of your thoughts, is it similar in terms of that focus around technology since COVID?
Yes, I think, for us, the most important thing is, does technology allow us to deliver our mission more efficiently? Yeah. But essentially the mission's the same. I think the danger, and I've seen it with other organizations within our sector, is that they felt that they had to change the essence of who they were and what they did. And actually, I think it's more vital to focus on what you do really well. I happen to have many years ago, some tech involvement in my work, in my career. And so that adaptation for me was fine, but my staff really struggled with that. Yeah. And so we had to sit down and agree that actually what we're good at is assisting people to unlock their expertise, understand that they can reclaim some of the power that mental ill health has taken away, or understand that they have an expertise that can allow them to really move through life in a resilient way, and very much upskilled and skilled to be able to understand their emotional health. And so that's what we were good at. So anything that we did in terms of tech coming into the organization had to support that mission. And it's very tempting because there is massive amounts of ways that tech can be applied. And, we have a couple of nerds that work for us here. And so we spend a couple of weeks, go oohing and ahhing at all the wonderful tech that we could have chosen to move. Yeah. But ultimately, it had to go through the filter of, does this help our clients? Does this help our participants? Do they understand it better? And so we actually ended up stripping it back and really starting to recreate the things that we know that work face to face. And also to give clients, moving forward, things will open back up again. The question for organizations will be, do you fall back to the way that you were, or do you build in your knowledge from the last 2 or 3 years to move your organization that bit further in? And it's modality for me. Certainly, we used Zoom extensively, not just to support our clients and participants, but also to support each other. Yeah. And so what are the elements of that worked really well, and we can keep those? The second thing I would like to say in terms of opportunity and moving forward and what the future looks like is that organizations should not be scared to innovate. It is drummed into all of us through training over the years that we must work on evidence-based practice. And very often a lot of us make the assumption that comes from academia. And whilst that is absolutely the cornerstone of it, there is lots and lots of lived experience that can equally be as valid and produce an evidence base. And so the evidence that we are gathering from our participants about their experiences of our services online is vital to add to that evidence base moving forward, to pick out what worked. And from that platform, you can innovate. For me, it's about asking, what would it be like if we could, and then recognizing that those wonderful ideas and fantastic visions that you have do not have to be implemented by you, but can actually be working collaboratively with a tech partner such as yourselves, to impart that vision to you and for you guys to then create the reality of it, allowing us as a mental health organization to constantly check with our users, does this work for you? What would make it better? And giving people a voice to be able to say what works for them. That's so important. But I think tech saved a lot of people during lockdown. And I think we should never forget that. And we shouldn't be afraid to embrace the idea of it moving forward.
Yeah, it's wow.
There's a lot in there. It's quite the idea that innovation for innovation's sake is something that we come up against all the time, and quite often a big part of, well, certainly Gabby's job when she's sort of speaking to prospective clients and stuff, is to say, you don't need an app to do this. I'm not sure, you know, it's not always the answer to everything, because a lot of people are, we need an app, or we need a website, or we need whatever it is. And it's important to really push that about, with not just for a whole load of reasons, but it's not always the answer to just say, because it is possible to make an app for most things, there's an app for that, right? But whether that's good or useful for the end user is a completely different thing. Just purely, to be honest, from the sake of, is somebody going to actually use the flipping thing? Because
for me, Rich, it's always about working from the outcome backwards. You know, what do you want to achieve? What is the outcome? If it's a particular outcome for an individual, or if it's an outcome from a group of people, always focus on the outcome first, then work back. And if tech happens to be part of that solution, that's fantastic. You can find ways to work, but you know, most of us will have to seek some form of investment or funding to be able to do this. And so we need to be able to produce an outcome to say to people, this is the difference that this will make. So start with the outcome, work back from that.
What's really interesting, just from a kind of sort of top level point of view, often a way we look at it is this something where we're trying to remove friction? So are we trying to make this activity easier, so this transaction, so frictionless? And it seems to me like, actually in this area, you're probably not trying to reduce friction. You're trying to make people think a bit and stop and maybe consider what they're doing or how they're feeling. So maybe technology is not brilliant for doing it. It can be used for doing that, but where it's really brilliant is actually when the sort of technology disappears and things just happen because of it.
Yeah, I mean, Nick, there's so much, and all of it, I keep thinking of yourselves and in terms of the things that you're looking to do, and how much of a big focus, as you've just said, kind of technology is going to be for you. Have you got anything to add in this particular area for the future?
Yes, well, our vision very much is, and central to everything we're doing, is how can we use digital tools to facilitate real, effective human relationships in the physical world. So, for instance, I mean, you mentioned earlier about the impact of COVID. One of the impacts of COVID, of course, has been what the Royal College of Psychiatrists called a tsunami of mental ill health. And certainly our daughter, who's a regular GP, she will say, every day, you've got across the country parents taking their son, daughter to the doctor and saying, look, I think they're developing anxiety or depression or eating disorder, OCD, self-harm. What can you do, doctor? And the reality is that there is such a pressure. I mean, the NHS currently has over 370,000 children on long waiting lists, and an estimated further 2 million children who don't yet meet the threshold because they're not yet ill enough. And that's where the tragedy comes sometimes, where the kind of message that parents will pick up is, my child is not yet ill enough, so kind of go away until they're more ill, and then you can come back. And that doesn't help anybody, does it? But there's a huge amount that parents can do if they're providing knowledge and skills and tools to facilitate that kind of family-based self-help. But the doctor hasn't got time to actually teach that knowledge, teach those skills, or train people in or providing tools. But one can facilitate that digitally, and that's our vision, so that they can go back and then use Headway, use the parent toolkit to learn about knowledge and skills, and then use the insight tools and therapeutic activities. But all of it is designed to facilitate that actual physical world interaction, what they're actually doing in the physical world. So whether that's addressing underlying risk factors like perfectionism or negative emotionality or body dissatisfaction, whatever are the drivers that are driving that mental ill health, to be able to have the knowledge and skills and then the tools in the hand to be able to apply that in the family situation. But key to it is it takes place in the physical world, but it's facilitated by the digital. It's not that the digital is a solution. The digital is a means to facilitate that family-based self-help within the physical world.
I think that's really interesting. And in terms of when we, think back to why we're here, what we're talking about, how can mental health charities harness technology? I think there's been some really amazing themes that have come out of the kind of discussion we've been having today in terms of how are you using that technology to achieve your mission? Like, what is it that the users are going to be getting? How's the impact? What's the driver? And in terms of those tools, what's the tools that the digital kind of output can help those users in terms of sustaining that kind of long term and that delivery that might be outside of the digital world, from what you're all saying, in terms of it being a really key driver to support someone with potentially those skills to be transferable throughout the rest of their life. I think that's really powerful in terms of the things that we've talked about. And at this point, I am getting waved at because I think there is questions. So I was trying not to notice Crystal, but Crystal, I think we have a question for the panelists.
We do have a question. It's a big one, which is a nightmare for a fast talker. So I will speak clearly. Okay. Mental health and well-being is being increasingly monetized, and the market is now incredibly saturated with providers with very few barriers to entering the market. Is there an opportunity to use technology to audit/monitor providers and the quality of their service to offer individuals a means of identifying which providers deliver the highest quality support?
Wow, that was, I don't know if Crystal made that somewhere. So in terms of summary, so in a market that's increasingly monetized, is there any way of auditing and monitoring providers to help users kind of cut through that market?
How do we make sure the quality is someone to check to make sure the quality is there?
To make sure the quality is there. Yeah, how do we know who the good guys are? There we go.
How do we know who the good actors are in this market when it is getting saturated? And as we said earlier on, there's a lot of money in it.
The ones we talked about, Headspace and Calm, they're not free. So I think there's also that kind of barrier in terms of people being able to access them. Panelists, are there any thoughts around that particular, how do you tell who the good guys are?
If I could just pop straight in there, I think, for me, it comes down to a very, very simple principle. Free market economics, whatever you want to call it. When people get something from a product, they use it.
Yeah.
When they don't get enough from it and they're not motivated to use it, it won't be there. I think natural selection will happen over the next year or two, where people will go in the same way that Calms and Headspace has broken through. There's been multiple brands that haven't broken through, and I think that's always a good sign.
Yeah, I think that's
there is if I can just say, there is a problem with natural selection though, Jill, and I'm sure you'd agree with this, that people can get hurt in the process. And so there is a need for making sure that what is delivered to the public is evidence-based. I mean, certainly our approach is we do a huge amount of research with our academic and clinical partners to make sure what we're building is drawn from evidence-based content, and then to evaluate it for its evidence base. Is it actually genuinely being effective? And of course, the MHRA, which was probably an acronym that no one knew anything about until the pandemic, well, many people didn't know, but the Medicines and Healthcare Regulatory Authority do have a process for regulating digital medical devices. Certainly with what we're doing in Headway, we're making sure that it will be compliant with the MHRA and can be licensed as a digital medical device. The problem is that there is a way that many providers get around. I got to be careful what I say. There are many ways in which many providers find that they don't need to register it with the MHRA as a digital medical device, because if you're not providing any diagnostic tools or therapeutic activities, it's advice and support for well-being, then it doesn't need approval by the MHRA. And so I think there are questions that need to be raised there in terms of how we can make sure that whatever is being offered, actually people can have confidence that it has got an evidence base to it and it is being evaluated for its effectiveness. I mean, certainly for me personally, I'm 65 years old. I could be retired on a beach now. I don't need to be doing this, but I'm only doing it because I want to help other families. You know, we're fundamentally a family that's been through it, that wants to help other families. And if what we're creating does not actually help other families, then there's no point doing it. We just want to help other families. So that I think to have that process of drawing upon evidence-based resources, and you are absolutely right, Jill, what you said before, some of that evidence base is academic and clinical, and some of it is lived experience, and it's the combination of both of those together is important, and then making sure that things are evaluated to see, are they actually effective? You know.
And I think, you know, Nick, it's very important to say there that, you know, traditionally our mental health services have been medicalized. They're part of the medical infrastructure. We see mental health as a much broader issue than that. There are social models out there. There's economic models out there. And I think we need to be open to new approaches. And that for me is where the knowledge equity comes in there. Despite all of the academia, which has built up a huge cornerstone of information, we have lost an awful lot of wealth of information by not actually talking to the people directly who are involved. And I do think that we need to question evidence base, because that's how we make that evidence base better. But yes, if advice to anybody out there, measure everything. Measure everything. Find some good statistician who can then pull apart those stats. But when you understand what's happening, then you know what you can do about it.
Yeah, I think hopefully that's answered the question that was asked. I don't believe there's any others at the moment, and looking at time, we're running out of time, and I feel like I could have carried on talking to you all so much longer. So thank you so much for coming on here today, sharing your experience, sharing your knowledge, and kind of helping guide that conversation. It was certainly really fascinating for us, and hopefully everyone else found it. So thank you so much for all your time.
Thanks, guys.
Thanks. So I think there's just one last thing to kind of draw everyone's attention to. Our next Text for Good talk will be on the 14th of December. We've already mentioned Christmas. We'll be even closer by then. And that is going to be Tech We Rated and Tech We Hated in 2021. So we're doing a bit of a roundup of the year and really looking forward to arguing that out with Richard Strachan himself. So yeah, hope you can join us then. Take care. See you soon. Bye.